Ochala wa Essential Media Uganda atela nga program joliko The Weekend Briefing wetukuwera amawulire agakoze enkizo bagabadde ag'enkizo mu week. Story eyokubiri gye tuddako ye story eya abasawo. Abasawo bavuddeyo ne bateeka gavumenti ku nninga ne bagamba ekimala we mubanga temutuwa facilitation na allowances tugenda kwekalakaasa, tugenda kusuula wansi ebikozesebwa. Abasawo bano oba bewandiise intern doctors. Jjukira ba intern doctors babeera basawo abatendeke abamaliriza okusoma. Etteeka ly'abasawo ligamba nti dokita waamala okusoma bamuteeka mu government facility okumala omwaka mulamba nga internship. So it is part of okufuna experience naye already babeera bamaze okugraduatinga. Kati beekalakaasa bagamba ssente government ze yali ebawa tekyazibawa. Tebalina transport, tebalina wakubeera, tebalina kyakulya, nga byonna government egamba babyesasulire kubanga bano babeera bagaininga experience. Kati bano bavudde ne bagamba government tukuwadde ennaku 15. Naku 15 singa tovaayo kwanikula ku nsonga eno gye tuliko tugenda teeka wansi ebikozesebwa tumanye nti nno nedda tetugenda kuddamu kukola era nga tujja kuba twatendinga kwabo cases eziri critical okitegeera.
N'olw'ensonga eyo ffe nga bannayuganda era abaweereza bannayuganda tuvuddeyo okwekubira omulanga nga tugamba nti osanga we tunaakola bwe tuti munaatuwuliriza ne ba stakeholders ab'enjawulo tunabatuukirira, tuwandiise ebbaluwa tezituuka. Olwaleero tugenda kutambula tugendeko ku Parliamentary yaffe tulabe oba we tunaasangayo speaker wa Parliament anaatuwa obudde n'atuwuliriza. Ensonga ya president tulina bingi mukama waffe bye twetaaga okugamba bingi nnyo kubanga abantu abakuli okumpi kirabika bakusibya akakookolo, ensonga zaffe tezikutuukirira era tusaba omukisa tukusinkane tukubuulire kubanga mu meeting gye twalina ne Minister Honorable Dr. Chris Baryomunsi ku Lwokutaano nga asatu omwezi oguwedde yatugamba nti ensonga yaffe yali mu cabinet naye ffenna tukimanyi bulungi cabinet ekulirwa mukulembeze wa ggwanga era omukulembeze w'eggwanga kati yalina obuyinza obukola ku nsonga zaffe. Batusuubiza nti meeting eyabadde eya Monday baali bagenda kutuula bagonjola ensonga zaffe naye paka kati tetunnaba kufuna kivaayo. Ennaku zigenda, Ministry y'ebyobulamu yatuwa ennaku kuvanga 3 August mpaka nga August 14 ogenda mu bitundu ebyenjawulo gye tugenda okukolera. Kati ennaku zigwayo ku Friday naye mpaka kati leero tuli ku Lwakusatu tetulina wadde kigamba
into the student life. And when a president comes and says so, you can start as being misinformed to believe that we are students. I once again re-echo, medical interns are not students, are graduated professionals who have their degree certificates and provisional working practice licenses. So we cannot be referred to as students because we know students cannot be facilitated to offer services. Thank you so much.
But what Uganda is playing on Mucharumo, and I'll get that.
Just one simple question.
Yes, what Uganda?
The question is, we see bodies like UPDF, sir. We see bodies.
The speaker, naye tetunafuna audience. Twagezaako kutambula tugende ku Ministry y'ebyobulamu kutwala ensonga zaffe. Naye twasa awo utwamala okutukulayo Minister nakkiriza owekitiibwa Dr. Chris Baryomunsi okubeera naffe mu lukiiko. Tulabe twakanya twateesa naye twatula kyankomeredde. Naye tulaga nti ddala ensonga zaffe entuufu nnyo era agamba agenda kuzituusaayo we mukulembeze gw'abantu ne mu lukiiko olukulu cabinet. Naye kyatugyeko enviiri ku mutwe nti olunaku lwajjo ye kennyini ate yavuddeyo n'agamba nti nno tetulina kyamaanyi kye tusobola kukola tetuli bamugaso era mu amanya gaffe gali mu penso wa mu kalaamu. So kiri era sawa yonna ayina n'obuyinza obusazaamu okukola kyayagala. Era agamba nti twagala tulina okugenda mu mbeera nga bwere ey'obugubi bweti tukolerere akawunga n'ebijanjaalo. Nayongerako bwe yatwe tumala bajja kutuwaayo essowaani endala ey'omuceere n'empuuta. Tugamba nti ffe tusobola kukolera mmere, tujja kukolera mpuuta, tujja kukolera muceere na bijanjaalo. Enjogera eyo in fact emalamu amaanyi era teyanivudde mu muntu ng'ono kutwatuwa ekitiibwa ennyo ate nga ye minisita waffe. Okutukakanya bwotyo, okukakanya profession eno ey'abasawo nti balina kukolera kawunga na bijanjaalo.
Bino bimala okugwa mu gavumenti nayo teyasirise nno yabaanikudde. Era okusinziira ku minisita ow'ebyobulamu Dr. Chris Baryomunsi we yabadde ku flo ya Parliament ng'ensonga eno ereeteddwa Leader of Opposition Joel Ssenyonyi, yavuddeyo n'ategeeza n'agamba bano bateekeddwa okuripootinga era omuntu atalipootinge gye bamudiployinga bajja mudismissinga. Ensonga zaabwe zatuuse mu cabinet era nga bagenda ziteesaako. Kati dokita yenna avayo n'agamba nti no tagenda kubeera ku mulimu olw'okuba nti no tebanakufuna facilitation, kajja mujjuutuka.
Medical doctors, healthcare professionals, key stakeholders and the general public. So I received this letter in two capacities. As a key stakeholder, because Parliament is a key stakeholder, and as a member of the general public, because indeed I am a member of the general public. Uganda Medical Association is giving a position on the welfare of medical interns. We have asked this question again and again. Government has yet to give us a satisfactory response. So the medical professionals are, one, encouraging the interns not to show up where they have been posted. It's in this letter. And number two, they are saying if in 14 days government has not addressed the issue of facilitation of medical interns, the doctors, all the doctors, are going to carry out industrial action and lay down their tools. And they're saying throughout the industrial action, only emergency care and essential life-saving services shall remain available. I firstly want to table this letter. I don't know if the Minister of Health has gotten his copy, but me, I've gotten mine as a member of the general public, so I'm laying. The concern, Mr. Speaker, is when this issue is not being addressed by government consistently, we get a problem. Because medical interns were posted. Many have not reported to their postings. Why they are saying they don't even have transport to get them there. They need resources to rent where they will be staying, for feeding, for transportation, because many will not be staying very close to their health facilities. And these people are saying they are not students. They are medical doctors who are now on practice for the 1 year that is mandatory. That's their argument. As I mentioned the other day, the Minister of Health was not around. He has been moving around different health facilities, sometimes in the middle of the night, 2 a.m., 3 a.m., to monitor. And who does he find at these health facilities? It is medical interns who are doing the bulk of the work. And so they're saying, government, why do you not want to value the work that they are doing? But number two, how do we expect them to go and do the heavy lifting? Sometimes they are on their postings for 48 hours non-stop. We need a response to this matter. Now I'm worried by all medical workers. And I know, Mr. Speaker, it's easy to say, you medical doctors, be patriotic and report to work. But they are saying, government, be patriotic and pay them for this service. We need a response to this matter, Mr. Speaker.
I did meet the leaders of the pre-interns, about 60 of them, and we had a lengthy and cordial discussion of about 6 hours. It is rare for a minister to accord 6 hours to a group because we have a lot of work that we do. But I patiently had a discussion with them for 6 hours, and we did agreed that one, yes, we share the concerns regarding the new policy measures regarding their welfare, and I undertook to do consultations, but urged them to report for deployment as the consultations get concluded. I think the challenge that these young people are getting are external forces that advise them, you lay down your tools, you don't report. I must state that the interns need that internship if they are going to practice the professions in which they have trained. Interns, I don't want to sound like insensitive, are not employees of government per se, but internship is a period when you are transiting from being a student to becoming a fully licensed professional. That should be clear. It is also not true that it is interns who run health care in this country. Yes, they make a contribution, they provide labor as they learn, but the health care is provided by different cadres in the health sector. For instance, we have health center 3s, health center 4s, and a number of district hospitals where we don't post interns. Are we saying they are closed?
Government nno nayo ekyali ku nninga, ekyali ku bunkenke, era nalabye Health Minister Dr. Chris Baryomunsi sako n'abakulu mu Ministerial bavudde ne ba meeting abamu ku basawo ne babako ensonga ze boogera, naye bagambye ng'ensonga zino zigenda mu cabinet. Basabye abasawo bano baddeyo bakole kubanga it is part of their work. Baddeyo bakole ng'ensonga zaabwe we zigenda mu cabinet. Abasawo kye baagala bafune facilitation ati singa akakadde kamu kuba ssente bazikendeeza, wabula ate gavumenti yeegamba nti zino ssente nnyingi eyinza obutazisobola era nga zirina financial unsustainability, era nga kino kiva ku ba graduates abeeyongedde. Kale nno ne bagamba babeere basooke bakkakkaneko baddeyo bakole ng'ensonga zaabwe we ziddayo mu cabinet ate esobole okubaganyizibwako ebirowoozo.
Which has been doing internship has now concluded their tour of duty, and now the new ones are reporting. We have not closed any hospital because there are no interns. So it is not true to say that it is the interns who run healthcare in this country, but we do definitely appreciate the work that they do as they train to get fully licensed. So I am sure the interns are watching me. They should get that fact that they need this internship. We have the commitment to address the concerns which they are raising, and that's why I'm asking for additional time to conclude my consultations so that I can come with the final position we are taking.
Honorable,
So,
do you anticipate when you might conclude the consultation?
maybe by next week I should be ready. Senior doctors usually are absent and cheat government. They don't even do adequate supervision of interns. So you find interns are doing the work and supervised most of the time. And there are discussions we are having in the ministry to bring reforms. Like we are going to discuss the issue of dual employment. I have said this in public, that you find a consultant doctor is employed in Murago Hospital, but probably he offers only 10% of his time to Murago. The rest of the time he's in his private clinic. There are doctors who are consultants in the government hospital, but you find he's heading a department in a private university, and that's where he spends time. So that the fact I have given you speaks to that the interns, you find most times do internship without proper supervision from the seniors. That's why I said the seniors were ordered to be on the wards and they were there in hospitals and mortality reduced. I can bring you documented evidence on that when I come.
Thank you, Honourable Minister.
So,
conclude.
In conclusion, my message to the pre-interns is that we expect them to report. And on the 15th of this month, I will ask the directors of the hospitals to give me an update in terms of who has reported. No. Allow me to run the ministry. And those who will not have reported will be considered to have forfeited their placement for internship as we handle their issues. So please, the pre-interns who are watching, report. No.
But Honourable Jomus, I don't know why you're listening to neighbors. You're the only one on record.
So let the interns report as their issues get handled, because we respect them, we respect what they are raising, and we feel concerned about them. We are not resisting what they are saying, so there should be, and they should not be misled by anybody to start confrontation with the government. It will not pay for them. I thank you very much.
Thank you.
Speaker.
Now, Honourable Minister, on our side, we hope you can conclude the consultations. We hope you can conclude the consultations.